climate health impacts are significant. People care about their child's asthma during bushfire events. They care about their elderly parents during extreme heat. And if we can make that very strong case about the health-climate connection, I think that's really important for us. And we are good spokespeople. Health professionals are the most trusted and respected professional group in all of society. You know, actually have huge leverage and influence. So that the impact of the profession and the advocacy and things that we can have, just as we had on smoking and seatbelts and other areas, is now what we need to bring to the climate debate. That professionalism, that influence, and that making it tangible for people. This is actually about their health and safety of their family members.
So how we relate to each other and relate to the environment. Like my daddy used to say, you know, don't take any more than what you actually need. And what you have, you share it around with everybody. So it's a change in attitude initially, and then it transforms into behavioural change.
And so with all of these different things, infrastructure, reusable things, renewable energy, reduced areas, better CSSD, what you're doing is still putting resources into the system, but you're retaining them and building up, and with every cycle, the whole system gets stronger and stronger and stronger. And so it's much more resilient and much more able to look after itself, and less waste is coming out the other end. And more of your investment of resources is being retained to make the system stronger and stronger.
When we talk about high value and high quality, it really isn't sustainable without a culturally safe behaviours, actually. So not just a lens, not just a policy, but we need people to act in a culturally safe way.
In the islands, we don't see climate change because we are going through climate crisis. In islands like Ngalo and coastal areas who heavily depend on fish for food security are impacted, and their health are impacted as well because of rising acidity in the ocean. 6 villages have already been relocated because of the primary impact of climate crisis on health and the people.
Our role as Larrakia elders or Larrakia people is really important because the hospital sits on our country, that we look after people that come here. So by working with Dr. Mark and greening the lands of the hospital, we'll get the word out to the community that want to come here. They've got access to healers. Their own healers have permission to go into the surrounding area and get in bush medicine, bush tucker that need to help for two-way healing.
Other studies are showing that staff members are more productive and that they actually are basing their employment decisions on being able to access green spaces like this at work. And I think this is instrumental in planning for workforce stability in a warming climate throughout Australia.